Do you come across clients where say they want to? I mean, they have multiple complaints, but they want you to focus on only one thing. For example, I have diabetes, hypertension, and high cholesterol, but I mean, I'm taking already many different allopathic or homeopathy other medicines. I mean, I come only for infertility. So please concentrate on infertility. Do you get such cases, or how to handle? How do you
Yes,
handle?
then definitely I do get such cases, and that's a quite interesting thing. I'll try to explain them. This is the thing what you're suffering from, and you want me to attend only this case. Only I can attend it, but provided if you are convinced about the outcome and how long you are going to take my medicines, that is a plus point number one. Second thing, I will not going to touch any medicines, or I don't prescribe anything for your other diseases which you're already taking medicines. So I'll keep aside, and whichever the things they are taking, I'll note down it, and you will give a typically time gap between the medicines of Western drug as well as our drug. Then I try to select our drugs for the particular condition for which he has approached me. There is no harm and wrong in doing in that way also. If a patient needs any type of thing which he is not getting inform thing, what do you call, he is not getting a in other doctors, if they are approaching to Ayurveda for that particular means, it's okay, no problem, no issues with that. We can handle even that condition. It doesn't mean that we only have to handle all the conditions in the present in one patient. Doesn't make any sense. If a patient wants that, that is better. It is because we are in a 21st century and it is a consumer driven field. We cannot simply, certain times we may have to stick on to our area, our domains. We should not leave it. Just what I said in the last class, that if some person asks for a particular type of medicine to be prescribed, then why he has approached me? You can prescribe by yourself. If you want me to do things, then let me allow to do it. It is my area. You should not trespass it. So that's the thing we need to understand. If a patient comes to us with certain type of things that I am suffering from these conditions, but I want only your medicine for this condition, can you do it? When such question is the first, I'll select that. Okay, no issues. We can do that. Once he develops a confidence in our treatment, slowly he is good able to observe the result. Then he only slowly shifts to our medicine. Then he'll ask, doctor, I am satisfied with the way you are handling me and my results are seen. So can you offer even the medicine for my diabetes and hypertension? Then he will come to us later. So that is our way of handling. And if you could able to give result in a right sense, definitely patients will take even for the other diseases what they're suffering from.
I mean, if the client is taking like a 78 allopathic medicines for cholesterol and different things, so when you pick Ayurveda medicines, do you kind of restrict the number of Ayurveda medicines that you're giving so that the patient doesn't forget and it's all mixed up?
No, I don't go for all those things. I concentrate on my area, which for which he has come to me, and whichever the drugs which are best suited to that condition, I'll prescribe. Maybe 2 drugs or 3 drugs or 5 drugs. Doesn't make any sense. I'll go with the whatever the drugs which is suitable for that condition, I'll prescribe.
When the client is taking like both Ayurveda and allopathy medicines together, I have a theory. I just want to cross check with you that better for them to take allopathy medicines first and then leave a gap of like 30 minutes and then Ayurvedic medicines.
I follow the same principle because almost all these allopathic drugs are synthetic one, and within 30 minutes usually they will be disintegrated and get absorbed. And once they go in, there will be some receptor based medicines and receptors they will carry, all these things will happen. So such things happen, then the drug interaction won't takes place. So that's the reason we keep at least 30 to 40 minutes gap, and preferably an allopathic drug should be taken first. If it is there in that prescribed by some doctor in that condition, then later Ayurveda drug, because Ayurveda drugs are most of them are herbal, and these herbal drugs may take some more extra time to get digested. So if we take herbal drugs in the beginning, then we may have to give a time of one hour or so, or 1.5 hours or so. So that becomes a lengthy time. So in order to overcome that or cut short that, I prefer usually if any person already taking some allopathic medicines and it is in the before food or even after food, then at the particular time, if our medicine has to be given, then I suggest them to keep it a half an hour gap. between these two medications.
Have you felt the need to use allopathic drugs for acute relief anytime?
No, definitely many times it happens because we are having some lacuna in having a, emergency management type of conditions. We do find certain times some difficulty, of course, but I don't go for prescribing it. I just say ask them to go to a person who can prescribe it, allopathic doctors, to take the things. I don't prescribe usually allopathic medicines.
And you might not be knowing because this is Dr. Rohini Guraj sir's wife. Sir opened a simple OPD clinic in the center of the city, and in a few months' time, there were like a lot many patients, even with the evening practice also. She told that I peculiarly remember that there will be some patients who would come with a vial and an injection that some other allopathic doctor has prescribed, and they want simple doctor to inject that. If such a client comes, she will honestly refer them to allopathy center rather than she doing it, or Gurus are doing it. Like very scientific in approach that what they do and what they are not doing. So so such a kind of boundary helps us to concentrate and focus on the diseases that we are really capable.
Definitely. So we need to draw our boundary lines where we are supposed to play and where we are not supposed to play. Allopathic drugs, we don't want to, because even though we know it, how it works, it can be given. We also been given training, but that is a secondary. I don't want to use it in that sense. Legally, there is a certain issues also, so we should not do it. So when that everything gets cleared, then it is up to our rational thinking whether to use it or not. That is a secondary issue. But right now, since my 21, 23 years of practice, I have not ventured into prescribing or using those medicines. If any situation arises, I will straight away send the patient to the Western medicine practitioners or allopathic practitioners for the particular type of requirement and services and treatments.
Another question has come, like when the client is taking like allopathic medicines, there can be side effects. For example, this amlodipine has bleeding gums problem, hypertensive medicine with bleeding gums, or paracetamol with liver, or painkillers with liver injuries. So how does one know if their health complaints are in fact the side effects of these medicines, or genine, the patient has definitely samprapti getting the symptoms? So how do we differentiate?
It's very difficult because we need to go for a very fine observation. We need to go for, if a suspicion is there in the beginning, then try to remove those drugs from the prescription for a time being, observe the facts. If the things are solved, then definitely it is due to the drug. If it is not, even with a drug withdrawal also we are getting the same results, means then it is not due to drug. Then you introduce the drug back to its original position and try to analyze for what reason particular lakshana is appearing, the bleeding is taking place. So accordingly treat the condition.
Was there any instance where like patient was like taking two or three allopathic medicines, and you asked the client to stop all and started afresh with purely Ayurveda?
Usually I don't do all those things, because when a patient comes to us with a lot of issues, we don't want to just remove their supporting stance. They are standing on some support. If you remove everything using it, it is not a right kind of doing in treatment. Because whenever Rutucharya has been explained, while shifting from one Rutu to other Rutu, the Sandhicharya has to be there. Slowly leave the things behind and then adopt the new things. The technique has to be adopted even here. We don't want to just simply jump from one to other. If we jump from one to other, there may be problem. So we don't usually prescribe, or we don't suggest that leave everything in the behind and come back to us and we will eat it. No, it's not the way. Slowly we convert that into our field without causing any harm. That's the method of what we adopted.
That sounds kind of in line with this. One is following Viruddhahara, and he has to be brought into the Patya Ahara. So Master Bhagavata says like padam chatam tyajet. So it should be like quarter by quarter.
Yes, definitely. It has to be left slowly, part by part, it has to be left, and the new things has to be imbibed.
One of the problems with Especially with the blood sugar or hypertension, the client is already taking allopathic medicines. This is one of the mistakes that the new Ayurveda doctors without much experience that they do is they see this 120 by 80 and though the person is on modern antihypertensive drug, they think that because it's already 120 by 80, they can like withdraw the modern antihypertensive, which can be really dangerous because the 120 by 80 is achieved by probably by the because of the medicines there.
First of all, we need to understand for what condition we are prescribing the medicine. First of all, the Ucha Raktachapa or hypertension is not a disease where we brand it as a cured. It is a Yapya Vyadhi. It has to be continuously, the medicine has to be taken. So in that sense, when by giving ideal or a normal range is achieved, when you remove the support, then once again it goes out of the way. It should not be done. If any person is consuming a medicine for particularly a sugar or hypertension, then it is reached to an ideal level or a normal range, means with the support of the drug and of course with the support of the diet and so many other factors. So don't disturb it. Just once it is reached, withdraw the drug. No, don't do that. Try to maintain the drug. Then in the next sittings, if continuously the same thing is achieved, then try to reduce the dosage of the drug. When you reduce the dosage of drug, next time also, if the blood parameters or even the hypertension parameters remain within the normal limits, then it is ideal. Otherwise, increase to the level optimal which is required for that condition. So that depends on case to case. It's not a uniform pattern for everybody.
Yeah, one small topic there, that somebody is on a modern anti-diabetic medicine and he is willing to switch to Ayurveda. How do you do it? Meaning gradually, or once in how many weeks you ask the client to come back and with a lab report for progression? What's the strategy there?
Usually 15 days gap I'll do it. Every 15 days I will go for the blood check as well as even this. Then accordingly we can finalize it. So we will go with a uniform pattern of whatever it is there in the LFT or even the lipid profile or something like that, or even the blood parameters and sugars. Accordingly, we will go step by step. Every 15 days, we will take a report and compare to the earlier one. And accordingly, whatever the outcome has come with the medication, based on that, we'll take a call.
Weaning of modern diabetic medicine, on an average, how many weeks or months that you take that you do the complete shift?
It is not so that in every case we cannot go that. If it is a newly diagnosed case with a recent onset, then definitely we can go with this type of weaning and all those things, and we can even able to achieve it, totally shifting the patient to Ayurveda medicines only. But patient is already 6 years, 7 years, 10 years are already known diabetic and he is taking a lot of medications, then still his blood sugars are not within control range, then we are introduced our drug along with the modern drug, then it has achieved to certain level, means we cannot simply wean the modern drugs here. Slowly we need to achieve the balance between these two. And many of my clients, they use both type of things, particularly in case of diabetes and hypertension. I've seen many of the patients, I can broadly classify them into 3 categories, where young new cases, very easily it can be brought to the purely Ayurveda category, drugs with Ayurveda management. Then we have got a middle section where both the type of drugs are required, modern drugs as well as Ayurveda drugs are required to control the condition, to bring it to the normalcy. Then we have another one, even with all these medication, they won't come into control range or normal range. That is the beyond the, and go on changing the dosages and even the drugs. It gives a lot of trouble in handling them. So such type of patients are also there, but there are fewer. People with clear cut them to Ayurveda. This is somewhat, let's say, about 30 to 40%, and remaining 30 to 40% is in the middle age one, because we need both the type of medications for them, and only remaining 10 to 20%, it is beyond our control. Such type of combinations, what I get usually in my practice.